Medical Sciences. The chairman of this occasion, another professor, a guru in human physiology, Afunwa Elotana, the former provost, College of Medicine, pioneer dean, Faculty of Basic Medicine.
Club isn't the best place to find lovers at the bar is where I go. Me and my friends at the table doing shots. Talk slow. Come over and start up a conversation with just me, and trust me, I'll give it a chance. Now take my hand, stop, and the man on the jukebox, and then we start to dance. And now I'm singing like, girl, you know I won't your love was handmade for somebody like me. Come on now, follow my lead. I may be crazy, don't mind me. Save me, save me, save me, save me, save me.
Also, we want to recognize the presence of the Dean of Faculty of Basic Medicine, Professor F.N. Ogwike. So you're welcome to the high table. You're welcome, sir. And also want to introduce to the high table another scholar who will share her wealth of knowledge to us during the plenary section of this conference. She is no other person than Dr. Sᴄɪᴇ. Ma, please, you're welcome to the high table. She is a senior lecturer in Department of Medical Microbiology, Faculty of Basic Clinical Sciences, Chukwuemeka Ojukwu University. You are welcome. Now, at this juncture, I will invite
Mastercraft on the beat.
Okay, please, may we all stand to cite the national anthem. Thereafter, the school anthem, the Anambra State anthem, the school anthem before we proceed. Thank you very much.
praise COOU and the light of the nation.
Science and technology is our lofty goal.
We hail and praise COOU and the light of the nation.
The great citadel of learning that stands as a giant and hope for the nation.
We hail and praise COOU and the light of the nation. We hail and praise COOU. We hail and cherish this great institution by the east of the Niger, the seat of wisdom and the strength of the nation. We hail and praise COOU. We hail and cherish this great institution by the east of the Niger, the seat of wisdom and the strength of the nation. To God be.
It's okay, please. Sorry. Thank you. Now, what this, you can see the national anthem has been changed to hip-hop music. What this Gen Z generation cannot do does not exist. Now, as the school anthem was going on, I discovered that all of you kept mute. I don't think it will be bad if that citing the school anthem comes up in examination as option 1B. I repeat, when we are citing the school anthem, among the students, nobody could even make, there's no movement of the lips. And I want to tell you, you can quote me any day, anytime. I want to tell you that don't be surprised if you see that question in the examination hall, BCH 202. And so, ladies and gentlemen, this is how I say welcome. Welcome to the 3rd International Conference of Faculty of Basic Medical Sciences, Chukwuemeka Odumegwu Ojukwu University, holding live at the ETF building of engineering. I want to also recognize other distinguished members of the faculty. Here present, Dr. Sᴄɪᴇɪ is here. The chairman LOC, Dr. Elizabeth Sᴄɪᴇɪ. We also have Dr. Charles from Department of Anatomy is here present. The PG students, you're all welcome. Other distinguished guests who will present their papers today from various universities, especially those from Nandasco University, I want to say you are highly welcome to this great occasion. I want to welcome Reverend Father Paulinus Onwoka here present. Present. At the same time, invite him to say the opening prayers. Thank you.
May we stand up? May we stand up? In the name of the Father, and of the Son, and of the Holy Spirit. Almighty God, we thank you for the gift of life you have given us, especially for the gift of good health. In the Gospel of Matthew, chapter 18, verse 20, wherever 2 or 3 gathered in your name, you are there. We have gathered here today for our 3rd scientific conference in the Faculty of Basic Medical Sciences. I pray in a very special way that you'll be with us in this our gathering, especially in this our academic thoughts. I pray in a very special way that you cover all of us gathered here with your precious blood of Jesus Christ. Whatever we are going to do today, Lord, let it yield a maximum benefit, so that at the end, the society will benefit from that. And whatever we are going to do today, God, let it be for the glorification and salvation of man. This I pray in Jesus' name. In the name of the Father, and of the Son, and of the Holy Spirit.
Enjoy your preservation. Enjoy your preservation. Renew in me a new spirit.
Without wasting much time, Ojukwu, at this junction, the dean of the faculty, we already have the chairman. As the law, from that, I think I'll start speaking Igbo now. Ayenwenoji, Dean, you are our, the host, as far as here is present, or the co-host. I don't know how to present it because, the co-host, because the vice chancellor is the chief host. So you are the host. So again, now, I get presented here to the chairman. While I hand over to the microphone to the chairman of the occasion. Thank you very much.
Chairman, Oji Abiakwa.
So as the chairman directs, Aga Ebugazi Oji, maybe I'll hand over the microphone to the chairman of the occasion, Keme KCMA. After the dean, you prepare for your welcome address. Then the chairman, local organizing committee, you prepare before we go to the keynote speaker. Thank you very much.
Biko, ekene m onye ọbụla. Ọ dị ka mewele ofu iche wee tụgbuo nnụnụ n'abọ. Onye na-akọwa ife a na-eme ebe a nke a na-akpọ MC n'Igbo ọ nọ nso ka mmalụ ife dị n'akwụkwọ wee ma ya nwe opportunity ime my opening remark ka ọ mmekọba ha ncha na ofu mme. Nya ọjị ka anyị ji n'aka. Kedu ofu okolobịa nya bute n'ọjị? Ihe debenu mmiri ka amalụ chi nke ị na-efe. Ngwa ka m welụnụ na mama nkwụwacha nwata ọtọ daba ada. Nyenụ onye nwe university, onye nwe faculty, dean wepụ n'ọjị. Enye na ọga anyị. Prof, wepụnụ. Enye prof nke ọzọ. Prof Egwurugwu. Ama na unu ebutere nkata ọjị. Ya na aya eji nka wee gbanya wee efi ọsọ. Kedu ụmụ nwoke nọ na ndị so akpa alụ ife anyị emebe a na-akpọ local organizing committee. Nye ofu nwoke n'ime fa ka o wepụta n'afa ndị na-akpa alụ ife a na-eme. Auntie Eliza, amakọ maka ọkwa Eliza ka nna agba ọkwa Elizabeth. Kedu nwoke gịnị anọ na committee a? Kedu nwoke gịnị a na-emekọ committee? Ngwa Dr. Lisa wepụ ọjị maka ndị otu unu. Onwe onye uli nọ ebe a. Onye uli bụkwa ezigbo mmadụ, ọ bụ ọkwechita amụghị anya mmadụ si m na onye uli. Onwere onye uli nọ ebe a. Onwe onye nọdebere uli ihe ala ma ọ bụ ndị zonu nọdebere uli nọ nke ọ wepụ ọjị ndị nwe obodo. Na onye nwaanyị nwe ọnwụ. O nwere mba bụrụ ọnwa akwa ya wepụrụ m ọjị. O nwere onye ihe ala zone nọ nso. Obodo ọbụla anọdebe ihe ala na ndị bịanụ. Fada amam obodo ịbụ na onye n'igwe nwere obodo. Mbịa ịnọ ebe ị na-eteka. Makwa nka ya eme. Ngwa o nwere student dị ka ezigbo mmadụ. Gbakwa ịkpọpụta nganga mmadụ si na onye uli. O nwere onye student dị ka ezigbo mmadụ bụ onye uli ma onye bụ ihe ala. Si na-emekwana n'ụbọchị na-aga ka ọ bịa were ọjị ndị uli. Egwu na-atụ unu ka agbakwa donation na ọka o were ọjị. ị na-ekwu na ndị ule adịghị ejezi akwụkwọ o nwere ndị ule nọ na basic medicine ọ sị gịnị sị na ọ bụrụ dị ka a na-achọ ebe a na ọjị ka a na-ekwu ngwa nye din ka o wepụtalụ ndị uli din jide nke ndị uli mgbe ọ na ha ji bịa kụọ aka na n'ụzọ gị enyefa bikonu kedu onye isi ndị ụmụ akwụkwọ onye isi ndị bamsa na nwoke ọgbakọ nwaanyị kedu onye ewepụta nke ndị bamsa na nwoke ọ nwere ọkụ nwoke nọ na bamsa ọ bụrụ iwu na ị ga-abụ executive din ndị atụkwakwa ha ojii ahụ o nwere onye bamsa n'ebe a o nwere onye bụ onye basic medicine n'ebe a bụ nwoke o nwere nwoke nọ na bamsa n'ebe a hey dị eke nke a na-achọzi gị achọ ngwa welu ofu ọjị ọ bụrụ ofe abụrụ physiology 406 onwe na-ebe ọjị kwesịrị ilo okay maka ndị postgraduate ya ndị graduate gonu ligo n'elu na-achọkwa ịda ọzọ ka onwe onye PG ewepụ n'afa ndị PG wejelụ fada ọjị fada wepụ n'afa ndị PG ịnalụ egozie ya ka ọ mụtakwuo ise okay ọ dịkwa nka ọ ya adịba na asị ọ bụ na ị na-eju ọmasị ekpochi na ị ya adabazi maka ndị njebata onye uli na ebe a kwesịrị ime na ife dị na ọjị afọrọnụ m ndị uli nwa amakwa mma vanye ma ọtọriti m gọba Igbo nwelu ndụ ọ na-abịa eji akpụ ya na nkwa ogbe ọ bịaza na agwa ya na-emetego n'afọ biko na ọjị nụ ka nji ọjị ka nji onye ọbụla nọdụ anị ụmụ nwaanyị nọdụ naanị unu ememe ife nwe ememe unu na afụdebe nsọ unu nọdụ naanị onye ọbụla nọdụ anị ụmụ nwaanyị nọdụ naanị ebe a ndị a nne n'anya nọdụ naanị na ọjị ka eji kwa mmadụ ka anyị na-agwa biko ọjị ka anyị ji ọjị a na-asị na omenala ejikọla Igbo niile ịbịa bụ onye Igbo ma ife ọ na-eme nwa afọ Igbo ife eji wee sị gị na ọ bụ ọjị ka ọ ya enye iji wee sị gị na ya anabata gị mmekwu kpori okwu maka amarọ m ekwu a sị na ife abịa ime tata ya adịla anyị mma na ife abịa ime taa ya adịla anyị mma na ife abịa ime taa ya adịla anyị mma ndụ onye ọbụla ka nji wee na-agụnye onye ọbụla ndụ wee na-asụ ndụ nka nka na ọ ya adịla anyị mma na achụba nke bụ ezigbo ife na anyị achụkwudo achụba nke bụ ife ọjọọ ịdachi ịda anyị n'ime onunu na Chineke naghị agọzi anyị nye anyị ogologo ndụ nye anyị okpokpo ndụ ndị dị n'ime anyị bụ ndị nugo nwaanyị nedonu nwunye anyị anya ma ụmụ ya mụtago ndị aka anụrụ ọfa achọbanụ nwaanyị ndị na-aka anụrụ achọba di unu nwawo ụmụ akwụkwọ bịala gụ akwa sị na ọ ya adịla unu mma na ọ ya adịla unu mma onye chụwa anya nwude mbọ nyara ife ọ gbatara na mbọ onye gụọ akwụkwọ nya pasị ya ma onye agụrụ akwụkwọ nya mee gịnị nya daa ọkwa unu kwe nke a onye agụrụ nya pasị kwuo nke a ya akakwa njọ a sị na ọ adịla anyị mma ndị chịkọbara ihe a ndị Faculty of Basic Medical Sciences ọ ka esi eme ọ nnọkọ ka anyị nwere ife a na-akpọ conference n'ọnụ oyibo ka a kpaa alo malụ ka obodo ya esi wee dị mma tụọ alo malụ ka sayensị ya esi wee gaa n'iru sayensị ife a na-akpọkwa ya ọgbaligbo gali nwee sị na ọ ya adịla anyị mma ka Chineke nna nọ n'eluigwe taa ọjị a n'otu ka ya taa n'ibe n'afa Jizọs Kraịst bụ onye nwe anyị tụọnụ m obu na mkpuke ọzọ mkpu obu na mkpuke n'Enugu Ukwu na Ụmụnri. Enugu Ukwu bụ isi Nigeria niile. Mechebịa ka nkọwa alụ.
So please, the Dean, Faculty of Basic Medicine, will deliver his welcome address. Thank you.
Dear distinguished professors, doctors, friends, and colleagues in the great citadel of learning, COOU. It is with immense joy and gratitude to the great and mighty God that I welcome everyone and all to the 3rd Faculty of Basic Medical Science Conference 2026. We couldn't have gathered here without the encouragement given to us by our honorable enterprising Vice Chancellor, Professor Kate Omenowa, a woman of focus, understanding, and wisdom. I acknowledge the presence of our erudite professors. You're welcome, sirs. Speakers, doctors, and learned personnel from our school, other universities, and all walks of life. We cannot forget our students in the Faculty of Basic Medical Sciences, their union leaders present here, and all the staff in the Faculty of Basic Medical Science here also. This great conference of our faculty has come to stay. Since it kicked off in 2021, when we had our first Faculty of Basic Medical Science Conference. Together we have come to rub minds on our scientific researches, posters, and the like to help inspire the young academias, train our students, and direct them on the way forward. I acknowledge the efforts of the former Dean, Professor I.J. Okafor, whose visionary leadership kept the faculty united till date. I acknowledge the efforts and encouragement of the Provost, College of Medicine, Chukwuemeka Odumegwu Ojukwu University Teaching Hospital, Professor Lawrence Ikako. He promised me that he will be here. He's on his way now. And Professor Jude Egurugu, also Provost of College of Medicine, Imo State University. He is the key speaker this morning. You're welcome, Prof. And other guest speakers, Professor Meludu and Dr. Sᴄɪᴇɪᴛ Cᴏɪᴄ, that's here with us. You are all welcome. I extend my heartfelt appreciation to all members and friends of the faculty and well-wishers who contributed one way or the other to make this conference a success. Your support has been invaluable, and we hope to count on your continual partnership as we work towards our collective vision. Special thanks go to our distinguished father and guest speaker, our founding father, Professor Frank Akbuaka, ably represented by erudite super professor W.C. Nwafia here with us, and other distinguished speakers. I also warmly acknowledge the presence of our friends. We have Ngozi Onwoku from Unizik. She's one of our friends that's always here, and others, the like, guests and supporters from various walks of life and cities who have joined us today. Your presence adds great color and meaning to this occasion. Together with the local organizing committee, ably represented and chaired by Dr. Mrs. Sᴄɪᴇ. Elizabeth, are you hearing your name? You're a powerful woman. We enjoy you to relax. Okay, relax. Don't be in a haste. We have something good for you. Celebrate with us and continue to pray for better days ahead. If there's any lapses here, just keep your question and your confusion. You can come to us privately and tell us, okay? So that you don't spoil our things. Thank you all, and may God bless you and the Faculty of Basic Medical Sciences, Chukwuemeka Odumegwu Ojukwu University, Uli Campus. I am Professor Francis N. Ogwike, Dean, Faculty of Basic Medical Science. Thank you.
They will also welcome the chairman, LOC, to deliver our welcome address. Thank you.
The Vice Chancellor of Chukwuemeka Odumegwu Ojukwu University, Anambra State, and members of Chukwuemeka Odumegwu Ojukwu Management Team, the Dean of the Faculty of Basic Medical Sciences, all the elders and professors of the faculty here present, our Faculty of Basic Medical Science members, our invited guests, our dear students, ladies and gentlemen. It is with great pleasure that I welcome you all most cordially to the official opening of this ceremony of our third international conference of the Faculty of Basic Medical Sciences. On behalf of the local organizing committee, the Faculty of Basic Medical Sciences, and the Chukwuemeka Odumegwu Ojukwu University, Anambra State. This event is the culmination of an enormous collective effort that began about 6 months ago when we were inaugurated as the local organizing committee members. Many individuals contributed in one form or another towards this meeting. I should like to take this opportunity to express my appreciation to all the members of the local organizing committee who made this meeting possible by sparing no effort. By sparing no effort. In the search for elusive funds and the running of errands. Faculty of Basic Medical Science has since its inception grown by leaps and bounds and has rightly taken its position among the faculties in Chukwuemeka Odumegwu Ojukwu University and even internationally. Our members have acquainted themselves well in international conferences, workshops, and symposia. And those who dare to export their skills have been employed in reputable universities worldwide and are discharging their duties credibly. The team, which states as follows: Basic Medical Sciences, the building blocks for healthcare delivery. It is hoped that the various presentations at this conference will expose to the light what has been unraveled, shed more light on gray areas, and stimulate further research for the future and the role of basic medical sciences in modern healthcare. Here gathered for the next 3 days or so are a collection of scholars of repute from within the country to share information on their finished and ongoing research efforts to explore avenue for collaborations. I therefore seize this opportunity to extend our appreciation to all our keynote speakers and the international participants who spared no effort to be here. Anambra is the light of the nation, and the Chukwuemeka Ojukwu University is the university of now and of the future. Visibility is our watchword. We therefore welcome all participants to enjoy the ambience. Distinguished visitors, let me express in the name of the local organizing committee our most sincere wish that the lectures and presentation in this conference will positively contribute to the consolidation of the aims and objective of Faculty of Basic Medical Sciences, and thereby to the philosophy underlaying it. Once again, I welcome you to Chukwuemeka Ojukwu University, Anambra State. Thank you. I remain my humble self, Dr. Sᴄɪᴇ Elizabeth Obioma, the local organizing committee chairman. Thank you very much.
Thank you. We announce the arrival of the HOT of Human Physiology. Oh, you know my name, so I'm not mentioning it. You know, Prof, yesterday we are doing a cocktail. I left the way I left you will not understand. Because something occurred to me. I remember that story, which my son eventually, I don't know how it got out of learning or by an error of commission or by commission. Yesterday we had a cocktail, I looked at the time, I was already after 8, and I remember that one of the assignments my son did, where they said names of animals that move at night. This medical practice, most times you have emergency at night, you move. And I remember that my son included my name as one of the animals that move at night. I've asked him several questions. Why did you include my name as one of the animals that move at night? He said that they told us that human beings are animals. And probably degree of Bachelor of Medical Sciences,
where boundaries of knowledge are tested, and where the future is actively engineered. Today, we gather here to discuss a theme that lies at the apple core of our academic and clinical mission: basic medical sciences, bedrock for effective healthcare delivery. We also look why basic medical sciences matter. One, the invisible infrastructure. We live in an era captivated
by clinical outcomes. The public rightly celebrates the surgeon who performs a flawless surgery. They applaud the obstetrician, the pediatrician who manages a complex pediatric emergency. We marvel at the visible, dramatic triumphs of healthcare delivery. But as an academic community, we are trained to look deeper. We know that the brilliant clinical decisions made at a patient's bedside is never an isolated event. It is the final milestone of a long journey that began in a laboratory, under a microscope, or inside a test tube. The basic medical sciences, namely anatomy, physiology, medical biochemistry, pathology, and pharmacology, are the invisible infrastructure of healthcare. Think of a magnificent skyscraper. The world admires its glass facades, its heights, its architectural beauty. But that building stands only because of an underground foundation buried deep in the depths, invisible to the passers-by. If that foundation cracks, the entire structure collapses. In healthcare system, the basic sciences is that foundation. Clinical medicine is the visible skyscraper. You cannot have effective healthcare delivery without a robust, rigorous, and deeply respected basic medical sciences. Basic medical sciences as the language of the human machine. To truly understand why these disciplines are the building blocks, we must look at what they teach us. They teach us the structural, functional, and chemical language of life itself. Anatomy provides the spatial map. They tell us where we are. Without a precise understanding of structural geography, a surgeon is a traveler lost in the dark forest without a compass. Physiology tells us how the machine runs when it is healthy. It explains the exquisite dynamic balance of homeostasis, the cellular rhythms, the various feedback loops, and the electrical impulses that keep us, all of us, alive. Biochemistry zooms in further translating life into its molecular syntax. It reveals how a single mutation in a genetic sequence can disrupt an entire metabolic pathway, altering the human life. Pathology bridges the gap between health and sick. They show us what happens when the defense system fails, identifying the microscopic invaders and structural failures that therein threaten human survival. Pharmacology provides the tools for intervention. It ensures that when we introduce a foreign chemical compound into the body, we do so with surgical precision, unlocking specific cellular receptors to restore balance. Without this deep integrated knowledge, medicine ceases to be a science. It reverts to guesswork. It becomes a series of trial and error experiments on human beings. Basic medical sciences elevate medicine from folklore to an empirical, predictable, and highly effective science. Basic medical sciences, these less nights in the library to feel disconnected from actual patient care. You might ask yourself, how does memorizing this molecular pathway help me save a life in the emergency room? The answer is simple: translational medicine. Every single modern medical advancement you will use in your future careers was born right here in the university laboratory. The targeted immunotherapy serving cancer patients today exists because basic science teachers spent decades studying cell surface receptors. The microRNA vaccines that alter the course of global history were not invented overnight. They were built on 30 years of foundational biochemistry research. The protocols we use to treat stroke and heart attacks were entirely dictated by our understanding of cellular physiology and ischemia. When you master basic sciences, you are not just passing an exam. You are acquiring the diagnostic vocabulary required to solve medical mysteries. You are learning why things happen, not just what to prescribe. A clinician who only knows what to do is a technician. A clinician who knows why they are doing it is simply a true healer. Because if you don't know the basic sciences, like what happened in one medical school during Viva, where is the appendix? He said the appendix is in the brain. It's not grounded in what? The basic medical sciences. Even outside the university, if you hope to be part of the Japa syndrome and you want to migrate to USA, which is the ultimate for most people, most young people, USMLE is step 1 is basic medical sciences, whether you like it or not. 4, the university's sacred duty. This brings me to the role of our universities. As a university community, we bear a heavy sacred responsibility. We are the guardians of this foundation knowledge. In a world that increasingly demands quick results, short-term metrics, and immediate commercialization, universities must remain the champions of basic research. We must protect the space for curiosity-driven sciences. History shows us that we cannot predict where the next great medical breakthroughs will come from. But we know that most Nobel Prize winners are from the basic medical sciences. It's the records idea. You can Google it. A researcher studying an obscure bacterial immune system in a basic science lab recently accidentally discovered CRISPR, C-R-I-C-P-R, a gene editing tool that has now revolutionized how we treat sickle cell disease and genetic blindness. It's from the basic medical sciences. Therefore, we must advocate fiercely for increased funding. Government and institutions must fund basic medical sciences heavily, recognizing them as long-term investments in national health care delivery system. Modernize infrastructure. Our laboratories must be equipped with the tools necessary to investigate life at the highest level. Like just 2 weeks ago, we came back from Ethiopia, where 191 provosts of medical schools in Africa had a conference. The world is now migrating to computer-based medical education. That's where the world is migrating to now. So we must try and key into it. Luckily, my own university was chosen as the simulation center for West African sub-region. Okay, the whole of West Africa, the center is at Imo State University now for maternal and child health simulation medicine. So this university should also key into it to advance medical knowledge. Interdisciplinary collaboration. The era of teaching anatomy alone, physiology alone, is gone and gone forever. We now do integrated teaching system, where if physiology is handling hypertension, the cardiologist from teaching hospital will come and teach the students hypertension. ECG, same way. The surgeon from the clinical side will come, teach the students basic clinical anatomy. So when you hear appendectomy, you know what we are talking about. So I encourage this university to embrace that integrative teaching method, where the basic sciences teachers collaborate with the clinicians for effective lecture delivery and care of our patients. Call to excellence. As I conclude, I want to address the different generations in this room. To our venerable faculty, such as the unseen heroes, thank you. Thank you for your patience, your dedication, your devotion, your diligence, and your unseen, unappreciated labor. You may not always get the public applause that a frontline Christian receives, but your papers, your teachings, your researches, your discoveries are the literal fuel keeping the engine of healthcare delivery running in this country. To our students and future healthcare professionals, embrace this phase of your education with fierce passion. Do not look for shortcuts. Do not treat basic sciences as a hurdle to jump over, so you can finally get to the real medicine. Basic medical sciences is the real medicine. Hence, your depth of understanding today will detect the safety and effectiveness of your patient's outcome and your future endeavor. Let us leave this hall today with a renewed commitment to academic excellence. Let us honor the building blocks. Let us celebrate the basic medical science teachers, not just as subjects in a curriculum, but as the foundational bedrock upon which the health, longevity, and future of humanity depends. Thank you, and God bless.
Thank you very much. Thank you for that wonderful speech. I remember, I don't know, the students, have you heard about the Trinity of Basic Medicine? That is my concept. Trinity of, Father, the other Trinity. That is my concept. It's coming soon. The Trinity of Basic Medicine. That is anatomy, physiology, and biochemistry. Prof, thank you. I don't know. You may get why I get seated before if there is any question, to come later. So the Trinity of Basic Medicine is anatomy, the concept of anatomy, physiology, and biochemistry. When I tell people God is omniscience, which means God knows science. God started this science we are practicing. When I tell them the concept of anatomy is just corpse. Just structure without any physiologic action. Now, God after molding the structures, the hands, the muscle, the piriformis, gluteus maximus and minimus, and all the muscles and all the bones. He now said, he become just like a corpse, a cadaver, no life. And he just gave a breath of life, and all the structures started functioning. That is physiology. Now, when God looked at this man and said, I've created anatomy, I've also given physiology. All the structures are functioning now. The structures are there, they're already functioning. Now, how do I sustain these structures and function? That's where biochemistry come in. That's why he now got these 6 classes of food. Now, after watching man, Bible didn't tell us how many years the man has lived. He discovered that the hormones, the reproductive hormones, are having positive and negative feedbacks. The reproductive hormones, testosterone, follicle stimulating hormone, and all the hormones are having, surges and negative, and that's why I said this hormone need to be controlled. That's where the invention of Eve. I used to tell people, when women misbehave, I said, there was no plan for you people in the initial time. Read the Bible very well. Okay, now, finally, Christ came in and also finally summarized that science by turning water into wine, in Canaan and Galilee. I used to tell people, my research shows that it was Heineken that was actually produced that time. So as you drink Heineken, you are fulfilling what the scripture said. Thank you very much. Thank you very much for that. Because of time, the dancers, we just have some dancers to entertain us, but because they are not ready, we want to welcome or introduce to the podium the erudite professor that will give us the first plenary session of this conference. Is no other person than Professor Samuel C. Melodo. Please, may we give you a round of applause as he mounts the podium to deliver the first plenary session of this conference. Thank you very much.
Bad times, bad times, bad times, bad times where I pay bride price. All the women where I follow them been do me one kind. I don't blame them, I been they poor. Like I don't care, they windows. But now.
Unfortunately, I can't be seeing that board. That's why I'm using my laptop. I hope it's projected. I hope it's projected. Okay, thank you very much. No, it should be the same thing. So first of all, may I acknowledge the presence of the provost, Professor Ikaiko. I'm sure we met. We met while I was on sabbatical leave in chemical pathology. So provost, you are welcome. And thank you for the opportunity to be here. Professor Wafia, the chairman, representing my big brother, Professor Abwaka. You are welcome. The keynote speaker, the dean of the faculty, all the professors present, the LOC, you've done a great job. I must appreciate that. I was there since yesterday, and a very good job done. Thank you. Then to the students, both, in fact, first of all, lecturers, my colleagues, and the students, postgraduate and undergraduate, I salute all of you. I observe that 70%, if not 80% of people seated there are more of the undergraduate students. And they are more of basic science students, physiology and anatomy. So my address will go more to you so that as we grow, we learn to grow in the right direction. Of course, I'm a clinical biochemist, studied biochemistry, then studied chemical pathology. But I'm probably in human biochemistry department as I speak. The topic or the theme, basic medical sciences, the building blocks for healthcare delivery, with a sub-theme of integrating innovations in science. The keynote speaker has touched in one good aspect, one part of the aspect I'm going to speak about. Though I was not given any specific topic, I'm just asked to get something out of it. So what I'm going to add is, what are the challenges, what are the benefits, and what are our outcome or realities as we look at this topic? Because these are the things we see almost on a daily basis. And by the grace of God, I'm in humility. I've been a teacher of basic medical sciences for over 35 years. And I've also been a professor for 22 years now. And for that reason, I think I'm very qualified to be standing before you. No knowledge is absolute anyway. We'll all still learn every day. So, in medicine or in medical practice, it was before now, some years back, looked at as basic medical sciences and clinical sciences. But we know in the last decade, if not 2 decades ago, the MDCN reclassified medicine, medical practice into basic medical sciences, basic clinical sciences, and clinical sciences. For our purpose here, I believe we are addressing particularly the basic medical sciences. The keynote speaker is also a part of what I have here. Did talk about the basic clinical sciences, about pathology, pharmacology, and so on and so forth. I will also still gloss over it. So, basic medical sciences, simply put, is the fundamental principles of medical science. He has said it, it's a building block. And it focuses on the understanding the human body and how the disease develops. You know, when they talk of physiology, for example, if you don't know exactly what is the norm, what it should be, you cannot know when there's something wrong. For example, if you know that temperature of a body is 37.4 degrees Celsius, if you know that, they will now know that when somebody is feeling is hot, and you check using temperature, and you're getting like 37.8, that becomes a what? Abnormal situation. This is what you get. You can as well say that is the foundation of medical knowledge. That's basic medical sciences. And it covers the basic concepts and principles that all the doctors, he touched on that, need to know to practice medicine. It also encompasses the human anatomy and its function. It involves learning the structures of human body and the diseases that affect these areas. On the other hand, clinical or basic clinical and clinical medicine. I try to make this distinction because, like I said, we are in basic. Focuses on diagnosis and treatment of diseases. Because for a doctor to treat a disease, your samples must be taken after taking the vital signs and taken to the lab, the pathology lab, and they will do some analysis, and they will see, after the assays, they will see, for example, your liver enzymes has gone beyond what it should be. Or they will see if your simple PVC, if it's very low. They will see the one we know commonly. If your blood sugar is very, very high against the normal, and that will now determine the treatment they will give. So they apply the principles of the knowledge of basic medical sciences to the real world or the real world setting. So they do diagnosis, they do treatment in a clinical setting. If I may go further, these students, are you listening? Are you doing your own discussions? If I may go further, you can say that basic medicine is more theoretical in nature, while clinical medicine is what? More practical in nature. So the basic medicine focuses on understanding the disease process, while clinical medicine focuses on diagnosis and treatment. More importantly, basic medical sciences or basic medicine focuses more on research. And my emphasis today will be more on the research, not necessarily on the teaching. And that's where you talk more about collaboration. That's why I talk more about collaboration. Anatomy can teach anatomy, physiology can teach physiology, biochemistry can teach biochemistry. But when it comes to research, you must put all of them together to be able to have something that's holistic. So, both basic medical practice, basic medical sciences or clinical sciences, they all together play a role in healthcare delivery. just like the keynote speaker did say. What are the building blocks or the core of the basic medical sciences? You have the anatomy, study of structures, you have physiology, study of how the body parts work together. You have biochemistry, the chemical reactions. And I'm not sure if we have any biochemistry students here. When I do introductory lectures, I always tell them, you don't need to be scared of biochemistry, because if your aged parents, for example, start complaining about joint pains and so on and so forth, you know what it is? They tell you it's arthritis. They tell you it is gout. What caused that? What's the cause of that? If somebody is, they say is suffering from sugar, what does that mean? So if you understand the biochemistry of it, you simply will know how that came out. So if you have been taught, even if you don't know the structures, but you know the concept, and you know what process leads to what, that will enhance your understanding. And that's why we will not be doing well as a student. So it's not something to be scared about. Of course, under basic clinical sciences, you have the pathology, have the pharmacology. Of course, by my training also, I'm a pathologist, a chemical pathologist. So I will not talk about that, but they deal more with that disease diagnosis, laboratory measurements from their knowledge of basic sciences. These sciences, whether basic clinical or clinical, they achieve one purpose, and that purpose is in two ways: diagnosis, treatment. Diagnosis and treatment. Let's move a bit out of it now. If you have the knowledge of all this, the question is, how do you get them together to work for good patient care? And that's where the second part of the something integrating innovations in sciences. How do you integrate them to get an outcome? So integrating science innovations, one, means taking new ideas from laboratories and turning them into real-world solutions that help people. And when we say laboratories, it's all the laboratories put together. Two, the process will link research, technology, and market successes to solve daily problems. And it takes new tools from a good idea to a usable product. And there are ways you can do that integration. First is match ideas to real needs. If you don't do that, your innovation will fail when there is no real world demand. What does that mean? For you to solve a problem, it's a problem you must have what? Noticed. You must have observed. And that's how a lot of research work came up. When there's abnormality in certain things, either the body composition, the body workings, and so on and so forth, what do? You have an eye to observe. And when you observe, your goal will be what? To make a move to treat such situations. Two is the integration of the disciplines. Integration of the disciplines. If I'm speaking to my students in class, they don't make noise. So can people just talk less? And that's what they call interdisciplinary research in basic and clinical medicine. I don't know how many people have this book. We have 21 abstracts. And out of 21 abstracts, 10 are multidisciplinary based. And I'll give the organizers a pass mark. We want to clap for the organizers. It is true that most universities now will tell you, I've just done an assessment for somebody who's going for to associate professor. They will tell you, you must be first author to have 100%. If you are the third author, you have 50%. University report will tell you when you have more than 3 authors, other ones will not count. Going by that method, they are not encouraging multidisciplinary research. And it kills our output in our research work and therefore in healthcare. Because when a biochemist, a physiologist, anatomist has done something, produced something, there must be clinical trials. And the clinicians must be involved. So why wouldn't it be multidisciplinary? You must take small steps. Like I said before, you discover new facts. Example, a lot of work now is on leaves or herbal, on leaves or seeds. They tell you it has what? Potentials, herbal potentials. Of course, in the olden days, our parents, our grandparents, they use such things to treat, but they don't know the basics. When you have observed that, then your work is to do what? Take that and try to make something good out of it. By testing how it works, by developing something that you extract that can be commercialized for the purpose of treatment. And you must choose existing knowledge. And what are those existing knowledge? Because that will help you to know what are the problems you want to solve or what are the ideas you want to work on. For example, you want to do research, whether you're a student, and a lot of you will do research at the end of the day. Final year research, you're a worker, you do a research work. Because if you don't publish, you perish. If you don't do your project, you will not graduate. You must take into considerations all those factors. And those you have to work with. Whether working with students, whether working with animals, whether working with farmers, depend all the groups. That will come from the existing knowledge of what has been done. Now, I'll move a bit further. When you do collaboration, what will it earn you? How will it get you to be effective? One is, it will help you to bridge the gap between the lab scientists and clinicians. And I've said it, when you do a research work, there must be a clinical trial. 2, it will help you to share access of biospecimens, lab equipment, and data. Because of our economy, I don't know if even this university, if the Faculty of Basic Medical Sciences can boast of modern equipment for research work. No, because they are very expensive. But when you do collaborative work, you can always identify places where they have this equipment and you can approach them And by doing that, it's no more a personal work. It's not a collaborative work. You may end up paying a certain token, but you don't have the knowledge of that equipment, or you don't have access to using that equipment, but those who will provide it for you. And you cannot write your papers and they will not be part of it. You must participate in multi-center trials. And you must seek for interdisciplinary grants. So you can do what? Scale up your research output. There are problems in our society today. So, you want to collaborate in basic medical sciences, it must involve combining specific laboratory expertise, clinical insights, and resources. And what are the most effective ways of doing that? 1, physician-scientist partnership. I've talked about that. Multi-institutional and consortium studies, share resources, and so on and so forth. Having said this, is it workable? Has it been working? Will it be able to work? The answer is yes, it can work. It can work. It worked, it's working in Western countries. In fact, if you go to a conference, see where a professor, a presenter, will, after presenting, he will list out names of people who are part of that research work, up to 20. And they're proud because they know you can't do it alone. So, the challenges. 1 is institutional and financial barriers. 1 is because of limited funding. 2 is bureaucracies. Because you must, of course, before you do your research work, you must present what? Your proposal to get ethical clearance. And sometimes they delay in approving that. Sometimes they will not even look at it, just approve without looking at it critically. Let me give you an example. There's almost, if you want to use human subjects, taking more than 10 mils of blood, I'm sure the pros will know, the former will know, is always seen as ethical issues. 10 mil of a blood from a subject. Even animal studies, there's a limit of blood, amount of blood you take, volume of blood you take. All this is supposed to be scrutinized by the ethics committee. But even in doing your research work, you must also know the volume of blood you want to take that will be enough for your studies. So there are ethical issues. They must go through ethics committee. The third one is misaligned reward system. I've talked about the issue of authorship. The issue of authorship, sole investigatorship. And maybe today, if I want to do a study, and I invite Professor Wafia, and yes, I know you want to go, that's why I decided to call your name. I invite Professor Wafia. His consideration will be, I want to be lead author. You can be anything. When you are doing a research work, a PhD student, MSc student, of course, the lead author is what? The student, and not your supervisor. I brought your supervisor is about the last in the authorship, because it shows that you're a mentor to mentor people and not struggling with a student to be lead author because of promotion. That's unethical. Interpersonal and cultural obstacles. The idea of sharing unified methodology. People always want to come with their own ideas, not wanting to try to streamline so they can work seamlessly on the research work. Power imbalance. Like I said, When you have well-funded lab and you have one junior researcher who wants to do something, because they are providing services, they want to relegate you to the background. It happens in our client here, in our society, but not abroad. Credit dispute. I'll talk about authorship, first or second or third authorship, intellectual property rights are part of the problems. Haven't talked about problems. What are the benefits? What do you benefit from doing collaborative research work? And remember, when I talk of collaborative research work, I'm talking of integrating innovation in science. But you cannot integrate if you're not collaborating. So that will drive, one is that it will drive innovation. It will help share costs. It will improve data quality. And it will unite diverse experts so that they'll be able to solve complex biological problems. First is a better science and innovation. Share scale, fewer mistakes, faster translation. If you are listening to the keynote speech, it also talks about translation. Because any research work you do that is not translated, and when you mean translation, it has to be put in use so that it will be beneficial in healthcare. If that is not done, you just wasted your time doing nothing. Another one is resources and growth. Like I said, it will lower costs. It may end up bringing more funding, and it will help you have a global reach. We are getting to it. So how will these researches in basic sciences help to improve human health? One, by uncovering core disease or disease mechanisms, creating new treatments, and enabling early diagnosis. It builds the foundation for medical breakthrough. You heard him when he talked about Nobel Prize winners from basic medical sciences. But I can tell you, those Nobel Prize winners they are not alone. They have people around, but the person giving that Nobel Prize is just the team leader. The team leader. There are people who have done better work, more work than that team leader in that outcome. So, specifically, one, it helps in uncovering disease mechanisms. You have mapping biology. You have identifying targets. You have tracking pathogens. Two, it helps in creating new treatments, developing drugs, advancing technology, personalizing care. Three, it helps to improve diagnostic and prevention, or diagnosis and prevention. And how does that happen? Early detection. Because when you do screening, like, I don't know if you know about this. How do people know there's sugar in the urine? When there's sugar in the urine, even at much early stage, because urine ought not to have sugar at all. When you go to urinate somewhere, and after some few minutes, you come across that place. You see ants filled up that place. In the olden days, they didn't know what it is. But that simply tells you that urine contains what? Abnormal substance, which is sugar, and should not be. That's the basis of even doing the multi-sticks and so on and so forth. And now when people go for medical outreach. Those people who probably may not know they're even diabetic, they're even hypertensive. When they do screening, they are discovered early and they can start treatment early. So, creating new treatments, that's developing drugs, advancing technology, personalizing care. Okay, I think about that. Improving diagnosis and prevention. I say early detection. And 2, risk assessment process. So I can pinpoint genetic or environmental risk factors to stop illnesses before they develop. Having said this, as I conclude, what you see on the screen is an outcome of a research work. I'm not the kind of person that wants to blow my trumpet, but for this purpose, it's developed by my wife, who is an agri-extensionist and a home economist. These are infusions. There are Zobo tea, not just Zobo, the other things in there, but the core component is Zobo. There are Swasop tea, and there are bitter leaf tea, along with other components. She developed it from the scratch. And my university, under the new VC, even want to patent it. She won the best award, the #1 award of innovation in last year, Anambra State Research and Innovation at Oka. I can tell you, this work, somebody just came back from Kenya 3 days ago, went and presented part of the work. And part of the work will also be presented sometime October in an international conference in India. But what am I saying? She developed this. It is the trials we did that is going international now. It's a trial we did. Therefore, this is a product of multidisciplinary research and innovation. Therefore, I enjoin you. Don't feel inferior to anybody, please. Never you. Whether I studied anatomy, whether I studied physiology as core course, you are so important. The keynote speaker talked about it, but I'm just emphasizing. They are so important. Without you, there's no medicine. Without you, there's no what? Medicine. But you cannot do what? Do it alone. You must seek collaboration. Where the need arises, you get clinicians. Where the need arises, we get those in biochemistry, those in anatomy, physiology. And by the way, if you are doing your PhD and you have a research work you have written, if you are going to use the hospital setting, you must have a clinical what? Supervisor. And that's part of collaboration. I thank you all for listening. We shall continue to move to God's glory.
Thank you, sir, for that wonderful presentation. Don't say I don't tell you, I tell you now. BCH 202 exam, number 1, cite the second stanza of Chukwuemeka Ojukwu University. Number 2, mention 5 ways by which basic medical sciences can help to improve human health. Expo. Inviting a group of hip-hop dancers. I hope you are ready. So please Hello. Okay, please. We want to welcome the hip hop dancers. Please, 5 minutes.
All right, ladies and gentlemen, if your hands are not too busy, let's give it up for a light motion in the building. Please, let's clap for them. Let's clap for them. DJ, drop it for a light motion. Let's do it.
You can imprison my body, but you not go fit to capture my soul. Ngolo wala kele mbali, but you not go fit to give my soul.
And she asked me if death sat next to you in a bar, looked you in the face, said the time is up, what would you say?
You stink with poverty.
Sᴄɪᴇ Okafor, the former Dean of Faculty of Basic Medicine, Chukwuemeka Ojukwu University. Thank you, Mr. Ibowende, thank you. I want to recognize the face of BAMSA, Mr. BAMSA and Ms. BAMSA. Please stand up for recognition. Thank you very much. We want to go to the first section of the scientific session. Standing beside me is Chukwuemeka Chika, a postgraduate student from Nnamdi Azikiwe University, Department of Human Biochemistry. Please, may we put a round of applause for her as she presents her first scientific presentation. Thank you.
Standing on the existing protocol, my research work is on the evaluation of cardinal-induced DNA damage, pro-inflammatory marker, and effects of and cumulative effects of treatment using Persea americana seed, avocado seed. The usual avocado seed we throw away. That is the substance I use as indicated in this scientific conference today, integrating innovation in sciences. So, carrageenan is a substance used for the study of anti-inflammatory properties of substances. Carrageenan induces inflammation, causing cascade increase in reactive oxygen species. And this is caused by the result of mitochondrial dysfunction, which activates the nuclear factor kappa B, which is the inflammatory pathway. This pathway leads to the increase in production of reactive oxygen species, which, when untreated, causes oxidative damage, such as destroying the proteins, lipids, and the DNA as well. Avocado seed is a known agricultural waste before now, but in the bid to better health sector, many researches such as this one I did went ahead, including the ones done, to see if the ethanol seed extract of this seed can ameliorate inflammation. Just as I said, the method used for this research, the carrageenan is a substance which is used to induce inflammation. I had 5 groups. Group 1, normal control group. Group 2, negative control group, which was induced of inflammation without treatment. Group 3, I administered 30 milligram per kg ethanol seed extract of Persea americana. Group 4, I administered 150 milligram per kg ethanol seed of Persea americana. Before this, then the last group, I used the conventional known drug, the ibuprofen drug, which is commonly taken when there is inflammation. We may ask, this inflammation is usually marked by pain, swelling, redness, sometimes loss of function of that particular area. They get me ibuprofen, ibu commonly called. So I use the standard ibuprofen drug, which is a known steroidal anti-inflammatory drug, to test the ameliorative effect as well on this inflamed Western RAS. Before the administration, I did a toxicity test using the OD50 by Lux method to determine if this ethanol seed extract is toxic, which is not. Okay, this is my method. First of all, I did phytochemical analysis of the extract, which I observed there are many phytochemical constituents in this seed, which is being thrown away, like the epicatine, the catine, and the rest of them. I did the OD50 determination. I had 75 RAS in the whole, which I've mentioned the group, 5 groups of 15 RAS. Go ahead. So, I administered these extracts for 2 weeks. I collected blood sample, but before then, I had to measure the pore sizes of these rats because one of the characteristics of inflammation is swelling. After the injection of carrageenan, I measured the pore size again to ensure that the inflammation had been induced. Then I started my treatment. Then for 2 weeks, I first of all sacrifice 6 rats because before you commence any research, there's what to call a baseline test to know actually what happened before the treatment. So I sacrificed 6 rats with the blood sample, analyzed the biochemical samples, Sᴄɪᴇɪlᴛɪғɪᴄ, which is a pro-inflammatory markers, the 8-hydroxydeoxyguanosine, which is used for the detecting of DNA damage. Then the last of the inflammatory marker was C-reactive protein. This particular C-reactive protein increases whenever there is an inflammation in the body. It's seen or detected from the liver. So, let's proceed. Okay, after this experiment, the blood samples are collected and are presented to my data analysis to know if the differences in these biochemical parameters from the baseline to 2 weeks of collection of samples, then to 28 days of collection of samples, if it was actually as a result of this treatment or something else causes, that is need for statistical analysis. Then p-value of less than 0.05 we are seen as what? Significantly different. Okay, these are my results. After 2 weeks, you can see from my table, these are the groups: the normal control group, the negative control group, 3,000 milligram per kg esapago, that is ethanol seed extract, Sᴄɪᴇɪlᴛɪғɪᴄ group, 150 milligram per kg. Then the 20 milligram per kg ibuprofen group. These are the baseline results. As I told you, you must know the values of these parameters, biochemical parameters, before you proceed, so that you can actually detect the change. Okay? So, go back to the first table. For the Sᴄɪᴇɪlᴛɪғɪᴄ enzyme, from negative control group, which is the untreated group, they are induced of inflammation but weren't treated. So you can see the increase in the Sᴄɪᴇɪlᴛɪղɪᴄ enzymes, and they are significant. Comparing 0 day, that is the baseline, and the 14-day evaluation, comparing the baseline and the 28-day, and even comparing the 14-day and 28 days of the analysis, you can see that they are significantly different, and which is as a result, they weren't treated. So there was sustained inflammation in those groups. Then look at the group, 30 milligram per kg group, that is group 3. I treated them after the induction of inflammation. You can see there's a reduction in Sᴄɪᴇɪlᴛɪղɪᴄ enzyme, and this is significant. So this seed actually ameliorated the inflammatory pain or disease caused by this carrageenan in these rats. The same thing with the lower dose. And comparing it with ibuprofen, which is a non-conventional anti-inflammatory drugs, you can see they match. They all reduce the concentration of Sᴄɪᴇɪlᴛɪղɪᴄ enzyme 1. Then the same thing to 2, Sᴄɪᴇɪlᴛɪղɪᴄ enzyme 2, and even CRP, that is C-reactive protein. These extracts ameliorated the inflammatory changes in these biochemical markers. So, and what could bring about this change? Previously, before now, avocado seed is being thrown away. But for the fact, the research has been going on how to better human life. Many researches, as I said, have gone concerning this seed. So my own quota is, I've seen in this research work that this seed, because of its rich in phenolic compound, that is the active bioactive compounds in plants, just as Prof said, previously before now in the olden days, our forefathers, they make use of seeds, leaves, unlike now, you people prefer Indomie. But there is still need to go back. So this Pesta Americana seed, in these dosages, both 30 and 1,000, 3,000 and 1,500 milligrams per kg treated group, and comparing it with ibuprofen group, which is a non-conventional drug, ameliorated inflammatory pain, as seen in the biochemical markers analyzed in this research work. What brought about it is the active bioactive content in this avocado seed, the phenolic and flavonoid compounds such as quercetin, decatine, camphorol. These active bioactive compounds, they are known to mitigate or reduce reactive oxygen species from the damaging of our body cells. So, contributing to the conference today, do not throw away the seeds of avocado again. You can grind it after you eat the pulp. From previous research, the antioxidant content of this seed is higher than the one contained in the pulp we lick. So we have been throwing away the most important thing and eating the lesser ones. So you just get the seed, dry it, and grind it into powder. You can add it to your food. So this is it from my research, and thank you. Okay.
Thank you very much.
You can ask your questions.
Thank you very much for that wonderful question. Please, if there is any comment by the erudite professors here, questions, please, we just take that 2 minutes, 2 to 3 minutes. Any comment? Any comment or question from the students?
Yeah, just a simple question. Which type of avocado pea are you recommending? Is it the ripe, the green colored, or the brown, soft colored? Which one are you recommending we should use?
Every avocado pea, we're just talking about the seed.
The seed.
Yes, whichever one you have, the seed we are talking about.
Okay, are you aware that the contents of that seed will not be the same? If it's green colored, that is not ripe. And when it's brown colored, that's when it's completely ripe. Are you aware that the contents will not be the same?
Like the ones I use anyway, they are the ripe seed. So I would suggest you use the ripe seed in that
so
case.
you recommend the ripe
Yes,
based on
the
what you
ripe seed,
study?
because that's what I use for my research work.
Good,
Yeah.
good, thank you.
Thank you.
Okay, thank you very much. From the mandate of the dean, I want to, inform the students that you should be patient, that your entertainment is coming. On that note, you know, they used to tell us a patient dog eat the fattest bowl. But that patient dog, hunger don't kill him. Hunger don't. Please, can postgraduate or even students, you know, when you are doing MS, when you are doing your BSc, they say you are studying physiology, you are studying this. But why is it that when it becomes MSc, PhD, they will say you are pursuing MSc, pursuing postgraduate? You know, during my own time, I never understood that word until when I enrolled to pursue masters. Actually, that word pursuing, oh my God, is actually pursuing. As they pursue them, things go wrong. You know, when we started, we used to dress well, with tie, you know, with suit, PhD student, PhD student. By the time PhD finished with you, towards the end, you wouldn't even remember where your tie and your suit is. So please, I'm giving you go and research. Why is it that BSc, you wouldn't see that adverb, pursuing? Why is it that it's only in masters and PhD that the word, I'm pursuing my masters, I'm pursuing, why? Why are they using that word, pursuing? For the BSc student, I'm giving you that question. I've given you a hint. Why that word, pursuing? That is an assignment for you. So on that note, I want to invite Dr. Sᴄɪᴇɪᴛɪғɪᴄ for the second plenary section. Immediately after that, we'll have enough time for the entertainment gist, for an entertainment, and for the last dance cultural group. Thank you very much.
It's not on. Okay. DJ.
Blah 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 black sheep. Black sheep. See, I don't retire, so I want my pension now. Suppress desires. Can I get my attention back? Can I act like I'm free? I know I serve my time very well. Can I act like I'm free? Matter of fact, can you take a picture to mark this?
The chairman, sir, my provost, my dean, distinguished professors, my wonderful colleagues, lecturers, students, ladies and gentlemen. It is a great privilege to address this distinguished gathering on one of the greatest public health threats of the 21st century, antimicrobial resistance. My topic is combating antimicrobial resistance through behavioral change and scientific innovation, building a sustainable future for global health. Antimicrobial resistance has emerged as one of the greatest threats to modern medicine. The very drugs that transformed healthcare in the 20th century are gradually losing their effectiveness. Imagine a future where a minor cut, a routine cesarean section, or a simple urinary tract infection becomes a death sentence. Not because we do not have good hospitals or doctors, but because antibiotics no longer work. What do we hope to achieve from this presentation? At the end of this presentation, participants should be able to understand the global burden of antimicrobial resistance. They should be able to identify human behaviors that accelerate antimicrobial resistance, understand the science behind resistance. They should be able to discuss innovative scientific approaches to combating antimicrobial resistance, appreciate the critical role of basic medical scientists in combating antimicrobial resistance. What are the current global and national burden? Number one is mortality burden. Antimicrobial resistance is often regarded as the silent pandemic. Silent pandemic. Because it's spreading globally and causing millions of deaths annually. But majority of us are ignorant of that. What if I told you that by 2050, antimicrobial resistance could kill more people than cancer? Would you believe me? It sounds so outrageous, but that is the actual fact. Statistics have shown that by 2050, antimicrobial resistance could claim more lives than many major diseases combined if urgent action is not taken. According to the report of WHO, in 2019, the landmark global research estimated that the number of deaths caused by HIV/AIDS was approximately 860,000. That of malaria was approximately 640,000. But that of antimicrobial resistance was as high as 1.27 million. You can imagine the margin. Showing that antimicrobial resistance could cause more deaths than HIV/AIDS and malaria. The next one is economic burden. Antimicrobial resistance is not only a health problem, it is also an economic crisis. From the report of WHO, antimicrobial resistance could generate up to $8 trillion in additional healthcare costs by 2050. There are so many organisms that are involved in antimicrobial resistance, but the major pathogens driving this burden include methicillin-resistant Staphylococcus aureus, drug-resistant Escherichia coli, drug-resistant Klebsiella pneumoniae, drug-resistant Pseudomonas aeruginosa, and then drug-resistant Mycobacterium tuberculosis. What is the situation in Nigeria? What about us in Nigeria? Nigeria is not exception. So, antimicrobial resistance is no longer a future threat in Nigeria. It is already affecting every clinical practices. Nigeria is considered one of the countries with a high burden of antimicrobial resistance. According to the recent Nigerian data on the National Antimicrobial Resistance Surveillance Analysis involving more than 25 public laboratories, Escherichia coli and Klebsiella pneumoniae exhibits approximately 80% resistance to cephalosporin. Cephalosporin is one of the most commonly prescribed antibiotics classes for the infection caused by these organisms. So the clinical implication is that empirical treatment with third-generation cephalosporins is no longer reliable. Why is antimicrobial resistance high in Nigeria? Why is it high in Nigeria? The problem with us is with our system. Everyone has easy access to antibiotics. There is no government policy that regulates how antibiotics are being procured. Anyone can easily go to a pharmacy store and purchase any type of antibiotics he or she wants. So that's the problem with our country. What is antimicrobial resistance. Let us understand what is this antimicrobial resistance. It is an ability of microorganisms to resist effects of antimicrobial agents that were previously effective against them. Did you hear the word previously? Against them. So it was effective before, but later it became non-effective. What are the science behind antimicrobial resistance? There are a lot of mechanisms that are involved in antimicrobial resistance. The first one is enzyme production. Enzyme production or enzyme inactivation. Some bacteria can produce enzymes that can inactivate antibiotics. For example, the beta-lactamase enzymes produced by some gram-positive organisms like Staphylococcus aureus and some gram-negative organisms like Escherichia coli. These beta-lactamase enzymes can break down the beta-lactam antibiotics like penicillin and then cephalosporin. Another mechanism is the one we call efflux pumps. Efflux pumps. This is a specialized protein present in bacterial cell membrane that pump out antibiotics, reducing their effectiveness. So when you take antibiotics, thinking that you have taken enough, the organism will use this efflux pump to pump it out. So there won't be enough concentration, to kill the bacteria. There are other mechanisms like target modification. Bacteria alter the target site of the antibiotics, reducing its binding affinity. When they don't bind with the bacteria, they will not be able to destroy the bacteria. Another one is gene transfer. Resistant genes from one bacteria can spread to other bacteria, either through conjugation, transformation, or transduction. Why should we care about this problem? Do we really need to care? Does it worth the stress? Yes. Antimicrobial resistance threatens nearly every aspect of medicine. Modern medicine depends on effective antibiotics. Without effective antibiotics, some procedures will have problems, like organ transplantation becomes risky, cancer chemotherapy becomes dangerous. Cancer chemotherapy can reduce the immune system of the patient, leading to opportunistic infections. So the patient will need antibiotics to sustain himself. So without effective antimicrobials, cancer chemotherapy becomes dangerous. Minor surgeries become life-threatening. There are lots of consequences of antimicrobial resistance. Imagine a patient with a simple urinary tract infection that will normally be cured in 3 days, and the etiologic agent is resistant to all first-line antibiotics. What happens? There will be treatment failure. And once there is treatment failure, the patient will continue to suffer. And the doctor will not, of course, discharge the patient. The patient will still be in the hospital. So there will be treatment failure, longer hospital stay. And at this period, the doctor will not keep quiet. The doctor will continue to struggle to make sure that the patient gets well. So what will the doctor do? The doctor will send the patient for more laboratory investigations. The doctor will continue to prescribe new drugs to the patient, thereby increasing the healthcare costs of the patient. So there are a whole lot of consequences of antimicrobial resistance that we need to bother. One is treatment failure, longer hospital stay, and then increased healthcare costs. Who is actually responsible for antimicrobial resistance? Is it bacteria or humans? Who is actually responsible? Some of us might blame bacteria. But the truth of the matter is that bacteria alone do not create antimicrobial resistance. Humans also do. Our daily choices, professional practices, environmental management, public policies, can create the perfect condition for resistant bacteria to emerge and spread. There are a lot of human practices that enhance antimicrobial resistance. Please permit me to ask us this question. How many of us have ever bought antibiotics without prescription, doctor's prescription? Please, can I see your hand? Am I the only person that have done that? Okay. Please, don't tell lies. So you have never bought antibiotics without doctor's prescription. There are some of us, when we are sick, we feel that we know what's wrong with us. We will go straight to the pharmacy store and purchase antibiotics and begin to take. Then, have you ever, doctor prescribed antibiotics for you. You are supposed to take it for maybe 7 days or 14 days, as the case may be. And after taking it for 3 days, you felt better and you abandoned the antibiotics. Have you ever done that? Please, can I see your hand? Yes, I've done that too. Okay. So then, how many of us, you are given antibiotics, you are given the prescription to take it, maybe TDS or BD, you are asked to take maybe one in the morning, one in the afternoon, one in the night. And you ended up taking only once daily. Have you ever done that? Okay. Then there are some of us, when we take it for 3 days and we became better, we'll go and keep the antibiotics for next episode. When we became sick again, maybe we have similar symptoms, we'll go back to the cupboard where we kept the antibiotics. You will bring it out again and continue. Have you ever done that? You see the problem? We are part of the problem because of our wrong practices. So the human practices that enhance antimicrobial resistance, there are so many of them. We have misuse and overuse of antibiotics in humans. Example, self-medication. Taking antibiotics for viral infection. When you take antibiotics for viral infection, you have not done yourself good. You have ended up, the antibiotics will not work on the virus. You will end up exposing the bacteria to the drugs so that only the sensitive ones will be destroyed. Then the resistant ones will be there and continue to multiply. And maybe next time, those bacteria, the resistant bacteria, will cause infections that will be very difficult to treat. Then, failure to complete the prescribed course. Failure to complete the prescribed course. When you fail to complete the prescribed course, you have reduced the concentration of the antibiotics that will kill the bacteria. So you've ended up allowing the resistant ones to multiply and spread. They can even spread the resistant gene to other pathogens. Then another one is inappropriate dosing. Inappropriate dosing, then poor public awareness. Poor public awareness. Our public, we need to be trained. Because we are in Faculty of Basic Medical Science, we are informed. So you take your knowledge outside. Inform your family members, your friends about what you have learned in the school. Then, poor infection prevention and control. This one does not directly create resistance. Instead, it allows resistance.
All right.
Okay. Another wrong practices is the poor infection prevention and control. Poor infection prevention and control. Sometimes when we don't prevent infection, we will have infection and we will have need for antibiotics, and then we can have antimicrobial resistance. These are some of the wrong practices that enhance antimicrobial resistance. Okay, we have a lot of scientific innovations against antimicrobial resistance. We have a lot of them. We are going to mention but few of them. Science remains the strongest weapon of humanity. The first scientific innovation we have here is rapid molecular diagnosis. Rapid molecular diagnosis. What we have on the present, when you have infection, the doctor will send you to the lab, and they will collect your sample. They will culture the sample for about, the culture will take about 2 or 3 days, after which you have additional day for susceptibility testing. So you see that by the time the culture result is out, it will be around, you have about 3 to 4 days for the scientists to release the results of the culture. So within that period, the patients will be suffering. The doctor will not keep quiet. Most of the time, the doctor will prescribe broad spectrum antibiotics to the patient, which is wrong. This unnecessary exposure accelerates antimicrobial resistance. So, but with the use of rapid molecular diagnostics, such as our PCR, PCR can identify pathogens and resistant genes within hours rather than days. So with the use of rapid molecular diagnostic, that test that would have taken 4 or 5 days will now take only hours. So there won't be need for doctor to start prescribing blindly, antibiotics to the patient. So another innovation is a microbiome-based therapies. Microbiome-based therapies. I hope you know that some infections occur as a result of displacement of beneficial bacteria. For example, bacterial vaginosis. Bacterial vaginosis is usually associated with dysbiosis of the vaginal microbiota, characterized by lactic acid producing lactobacilli. And the treatment of this bacterial vaginosis, usually antimicrobials, which is often associated with treatment failures and recurrences due to antimicrobial resistance. So scientists discovered that restoration of normal microbiome by oral consumption of good bacteria can be very useful or helpful in the treatment of such infection. Some years back, we did a research on bacterial vaginosis. We sampled women that have bacterial vaginosis. We collected their samples before and after feeding them with an organism called Lactobacillus pentosus KCA1. This Lactobacillus pentosus KCA1 is a probiotic. So we added it into the yogurt that we fed these women. After everything, we got a tremendous result. These women got better. We noticed that their vaginal ecosystem were restored back. The organisms that we are causing, that we are associated with bacterial vaginosis, reduced. And then there was increase in lactic acid producing lactobacilli. So this innovation, microbiome-based therapy, is really a wonderful innovation. I want to tell you that yogurt prepared well is good for women. Yogurt prepared well is good for women. It can restore back your vaginal ecosystem so that you will not have this infection like bacterial vaginosis. The next one is artificial intelligence. The next innovation is artificial intelligence. Example, Arrest Cloud. Arrest Cloud can assist us in predicting resistance before it happens. It's like the weather forecast. It's like the weather forecast. The system can analyze the information you input there, to predict the future resistance threat. So if you input this information like millions of susceptibility results, genomic data, prescription pattern, population trend, it will now predict the future resistance threat and then the likely treatment failure. So with the AI prediction, treatment guidelines can be adjusted before the crisis. Another innovation that is wonderful is the one we call CRISPR-based antibiotics, antimicrobials. CRISPR-based antimicrobials. This one is often called genetic scissors. Genetic scissors is a kind of technology that can be programmed to recognize a resistance gene and then cut it off. Unlike the traditional antibiotics that destroy both the pathogens and the normal flora, CRISPR antimicrobials are programmed with an exact genetic zip code belonging only to the pathogen. So if a patient is treated, the therapy will float harmlessly past billions of other microbiome. For example, assuming a bacterium is carrying a gene for cephalosporin resistance, CRISPR can be programmed to recognize that specific gene and then cut it off. The bacteria either dies or become susceptible again. Another wonderful innovation is the one we call nanotechnology. Nanotechnology are microscopic drug delivery systems that work like drones, you know drones, that can carry drugs precisely to where it is needed in the body. The technology uses tiny particles called nanoparticles that can carry antibiotics directly to infection sites. Even though nanotechnology and CRISPR, among other novel approaches, are still under investigation, but it's a wonderful innovation. Let us come back home. What is the role of basic medical scientists in combating antimicrobial resistance? Faculty of Basic Medical Science occupies a unique position in the fight against antimicrobial resistance. Unlike clinicians who primarily treat patients, basic medical scientists lay the scientific foundation upon which safe diagnosis, treatment, prevention, and policy are built. The first role is teaching. Teaching is the most powerful weapon basic medical scientists possess, because every student taught today becomes tomorrow's healthcare provider. Every lecture delivered, every experiment conducted, and every student trained can influence how antibiotics are used for decades to come. So we have to be intentional about our teaching. Our lecturers should teach well. Teach your students well, because they are the future scientists, they are the future doctors. When we become sick is these students that will treat us. So let us be intentional about our teaching, and then our students should be very serious with their studies. The next role is research. Basic medical scientists are the engine of scientific discovery, developing innovative diagnostics, therapeutics, and surveillance tools. Without research, there will be no new antibiotics, no rapid diagnostic tests, no vaccine. So we should invest so much on our research. Let us take our research work serious, please, so that we will help the public. We will help our generation. If you are doing research, be intentional about it. Don't just do it that you want to pass your exams, please. Another role of basic medical scientists is in community engagement. Knowledge should never remain inside university walls. Public should be educated about antimicrobial through public lectures. So we should be organizing public lectures, radio programs, television interviews, social media campaigns, community outreach. Rural health campaign is very, very important. Majority of people outside are ignorant. They make a lot of mistakes. So we need to educate our public. I remember I went to a chemist store to buy a drug. So as I was talking with the nurse, one man came in. He now asked the nurse, please, can you mix for me Ogu malaria? So the nurse quickly just mixed about 5 or 6 capsules and tablets and gave to the man. He now asked the man, how many doses do you want? The man said 1 dose. So he now mixed it and gave to the man. The man left. The man gave her, I think, 200 naira or 300 naira and left. I felt so bad. I told the nurse, what have you done? She now said, what will I do? I have to sell my drugs. That these people, when you try to explain to them, they will not understand. You know, that he doesn't have money. That is the one that maybe tomorrow he will come back to take another dosage. You can imagine. So we need to educate the public. One well-delivered public awareness campaign can prevent thousands of inappropriate antibiotic uses. So I advise us, students, sometimes if lecturers can help you, or you organize, a symposium, go to the marketplaces, go to the schools, meet the other departments that are not in science courses, and you educate them. This is part of the role of basic medical science. Another one is our policy advocacy, providing evidence-based recommendation to government and institutions. Scientific discoveries have little impact if they remain in journals. If you just continue to publish your the research work on the journals, it doesn't make sense to some people. Like me, I don't know how, when I read journals last. So you see that the public do not read journals. It's few people that read journals. So researchers must help government translate evidence into policy. This is where basic medical scientists become trusted advisors. Example, assuming from your research, you discover that 70% of bacteria causing urinary tract infection are resistant to ciprofloxacin. If this information gets to the Ministry of Health, it will help us. Treatment guidelines can be updated, and then doctors will be informed and prescribe more effective antibiotics, and resistance will be reduced. So then what are the behavioral change? We have to adapt to prevent antimicrobial resistance, because scientific breakthroughs alone cannot solve antimicrobial resistance. Human behavior must also change. We need to change our character. We need to change our practices. We all have a role to play in combating antimicrobial resistance. The individuals, you should use antibiotics only when prescribed by a qualified healthcare professional. Then always complete the prescribed course of antibiotics, even if you feel better after a few days. You shouldn't share antibiotics with family or friends, or prescribe to your friends. Some of us, when we are giving antibiotics and it works for us, maybe tomorrow your roommates will be sick and have the same symptoms. You now quickly prescribe the same antibiotics for your friend. It is wrong. You might be giving the person a wrong antibiotics. When you give the person a wrong antibiotics, it will cause antimicrobial resistance, because the drug, will only destroy the weak bacteria, even the normal flora. Then the resistance and the strong bacteria will stay and then continue to multiply and cause problem. Leftover medicine may not be the correct drug. The remaining quantity is often insufficient for a complete treatment. Another one is people should prevent infection before they occur. You have to observe personal hygiene. Prevention is better than cure. So wash your hand regularly. Wash your hand and prevent infection before they come. Then our healthcare workers should practice infection prevention. Wash hands before and after patient contact. There are some of our health workers, when they come to the ward to examine patients, some of them, once they have protected themselves, They'll just maybe use one glove to examine about 10 patients. That is very wrong. It's a very wrong practice. You are supposed to sterilize your hands after each patient. You sterilize your hands or you change the hand glove. Why? Because if you examine the first patient and assuming the patient is carrying methicillin-resistant Staphylococcus aureus, the doctor will transfer the microorganism from that patient to another patient and to another patient. That's why someone can come to the hospital with only one ailment and will leave with a lot of nosocomial infection. We should follow treatment guidelines, practice antimicrobial stewardship, educate patients. We need to educate our patients. I'm talking to doctors. Educate your patient. I was opportune to visit a doctor with my sister. Do you know this doctor took about 2 hours talking to us, telling us a lot of things, training, he passed a lot of information to me and my sister. I really appreciated the doctor. And I asked doctor, is that how you treat your patient? He said, yes. So that when they come for this ailment, they will not come back for that ailment again. But at the end of the day, he will add maybe 10,000 or 20,000 naira on top of the bill. But we shouldn't mind because it's better that you don't have infection. When you have antimicrobial resistance, it will cost you more money than even that 20,000 naira. Then the government should regulate antimicrobial cells, strengthen laboratory infrastructure, then support research funding, implement national antimicrobial resistance. Okay, before we conclude, please, can you play a short video, just 1 minute, for us to understand or appreciate this topic?
Bro, what? Antibiotic for what? It's just a little headache. Who on earth would take antibiotic for a headache? He probably knows what he's doing, right? Hell no, he doesn't. Then stop yapping and let's move that drug. Got you. Let's send it to the small intestine before it burns the walls again.
Hey, stop right there. Who let you in here?
Chill, Unc. I saw an open cut injury spot. Why wouldn't I come in? Plus, who do you think you are?
Hello, we're screwed. We just got a tear open section in the skin. Bacteria are already flooding in. Request white blood cell backup to get here and handle this ASAP.
You there. Your time is over.
The only thing over is you.
He just destroyed the white cell, and bacteria is now spreading. We need backup now.
This place is mine now.
Huh? Another one? Yo, this is the ice of body. Time for deportation, buddy.
That no longer works, boss. I've already mastered it. Taking antibiotics incorrectly helps me adapt and become harder to fight so your body can't resist. If you made it here, tell me in the comments how often you take antibiotics.
I hope, yes, we appreciate the video. It's really a wonderful video, to help us understand the topic. So as I conclude, let us remember that antimicrobial resistance is not a challenge for tomorrow. It is a reality today. As we leave this conference, let us commit ourselves to the fight against antimicrobial resistance. Every healthcare professional, individual, researcher, policymaker, lecturer, and student has a role to play in preserving the effectiveness of antimicrobials for generations yet unborn. The future of antibiotics depends not only on what scientists discover, but on the choices we make today. Let us choose wisely. Thank you, and God bless you all.
A round of applause for her for that wonderful presentation. May I invite the Provost of the College of Medicine for some remarks. Thank you. Please, the cultural dance be ready. After the Provost remark, then we'll conclude.
Good afternoon, everybody. Despite the fact that the protocol has been established, I will not fail to acknowledge some people here or even absent. Professor Frank or FC Abuaka, one of our founding fathers, is here ably represented by another one of our founding fathers in the person of Professor W.C. Wafia. My predecessor, he was also a predecessor of my own humble self. He was the provost of the College of Medicine. Also, I would like to acknowledge the presence of the Dean and the wonderful speakers, the guest speakers, the keynote speaker, the speakers, and the erudite scholars here. And of course, the great students. I must say thank you for having me in your midst. So I will say on behalf of our Vice Chancellor, the Vice Chancellor of the now University and of the future, the protagonist of the 3V's agenda. I hope you know what it means. Values, viability, and visibility. Propounded to enhance academic excellence and sustainable growth of the university. I say thank you very much to the organizers for bringing me once again to this wonderful place. I must thank the people of Uli campus, because I know they played a remarkable role in my election as the provost of the College of Medicine. And so, even though belated, I'm here today 2 years after, so to say thank you very much. Also, I decided to come to this place because of your topic, the nature of your topic. It says, can someone remind me? Yes, the basic medical science is the bedrock of healthcare delivery, and indeed it is. Nursery. I think, you're still there. You have nursery and nursery. Probably some of us have attended nursery. The type when you go to, when we went to school in those days, you're given a very big slate to the nursery school. At the end of the day, you can draw circles on the board, and they will always give you a very mighty good. But that's not the type of nursery we have these days. We have ones that are properly made, because we are trying to see if we can get it right at the onset, at the beginning. And so that is why we regard the basic medical sciences as the bedrock of healthcare delivery. I choose to call them the nursery of healthcare delivery, the starting point where everything must be correctly done. So basic medical sciences are the fundamental pillars of healthcare delivery. They are indeed. And they are often regarded as the nursery of the medical training, where a sound foundation must be laid to place healthcare delivery in a good footing. We see this as the bridge. Basic medical sciences will bridge the gap between human knowledge, human biology, and clinical practice. It bridges the gap between human biology and clinical practice. There is clinical practice. Some of you that are medical students will soon come over for clinical training over there. You have to get it right here, otherwise you'll find it very difficult to progress in the clinical section. And so, this is an important topic. And the keynote speaker talked about the different sections of basic medical science. It talked about physiology, the role of physiology, the role of biochemistry, anatomy, and pathology and micropathology and pharmacology. They are very important. All I'm going to say, my speech is a very short one. I don't intend to bore it because the day is fast spent. Is that we should recognize the importance of the basic medical sciences. I've listened to the presentations, especially the one on microbiology, on antimicrobial resistance. It's crucial, and then the basic medical scientists, they have a role to play because it's really a problem in Nigeria. It's a problem in Nigeria, antimicrobial resistance, and it is driven by us, by the abuse that we generate. He talks about somebody coming to buy antibiotic and is given for 1 day. Let me tell you, one day I traveled out. I'm sorry if I sound immodest. And I somehow felt sick, somehow. I approached the medicine store or the pharmacy to buy the usual ciprofloxacin. I, as a medical doctor, then a senior lecturer, when I told them, please, can I have some tablets of ciproflox? The people there started looking at themselves without saying anything. The difference here is that people here will quickly give you for 1 day or 2 days. They started saying, looking at themselves without saying anything. Nobody told me to retreat. I left without anything being sold to me. So if we want to get it right on this issue of antimicrobial resistance, we have to start some regularly here. Before I go, I got something for you for the students. I will hand it over to the students. I will hand it over to the dean. I got a projector, which I intend to leave. It's in my car. I'll hand it over to the dean. My very good friend, Ogwike, will have it for any class to borrow it for your lectures. It's free. It will remain in Oli for the rest of his life. So thank you very much.
Thank you. The dean also has a comment.
Hello? Hello? Why are you all keeping quiet? Are you not enjoying the scientific session? Don't worry, don't worry. We know you are tired. I've made arrangement for your food. The LOC chairman has brought your food. Yes, he's there. I know you're tired. Your children, you're tired. I feel what you feel. We feel what you feel, okay? But I want to tell you something. Do you see these 3 people that have spoken? The lady from Nnamdi Azikiwe University, the lady from, the doctor from Amako, Dr. Miss Sᴄɪᴇ, and the provost that just spoke now. Please try and learn something from them. Are you people hearing what I'm saying? 1, most people in anatomy and physiology feel that when they read BSc, no hope again. What are we going to do with this certificate? Some of them drop it and start doing POS. Some start selling shoes. Some start doing computer business center. You see? But look at what the woman that talked something on avocado seed. She said that, avocado seed. She said something about it, that we should not be throwing it away. We can grind it and use it as tea. In the time past, listen, in the time past, I heard that avocado seed helps in hypertension. Helps those in hypertension. But today again, another knowledge has been added. The second one is the second speaker, Dr. Chinwe. She said that yogurt, if you prepare a good yogurt, it helps women. in the to fight against vaginosis. You see, you can develop you can go and learn it. Yes, you can go and learn it and produce it. Bring it to our faculty. We will encourage our students to be buying it from you. Are you hearing what I'm saying? Business is here. So this scientific conference has given us a lot of exposition. I'm telling you the truth. I have a platform with BAMSA, our students that graduated before, BAMSA alumni. I have a platform with them. And I keep encouraging them to try to become in our conference. Here, when they come here, they will have connections. And they will also be exposed to scientific ideas. So that they will not think that it's just read and dump their certificate and get confused. There are a lot of things to learn from our scientific conference. This is the third one we're having. I don't know how many alumni students are here. So, but those of you that are here, just know that you pass through here is not the end of it. It is not the end. So try to cultivate that habit of coming around us. You will even see some lecturers that will promise you job. Yes, you have connection. You will see like these provosts that are here and all these other lecturers that they can tell you there is vacancy somewhere. Why don't you come and why don't you bring your application? That is the advantage of coming to conference. You come in to have connection with people. So I want to appreciate the provost for the donation. In fact, my hand is raised up for him. He gave us a projector. And this is the first time we are having somebody donating something for us in our scientific conference. So clap for him. Give him a very sound clap. Yes. No matter what you are, you need human beings. You cannot be the only three. And you can see our scientific conference have inspired him. He said that they will organize a medical conference in future. And they will invite us. And then we will be there. Can't you see that our effort is bringing out a fruit? That's why we are here. We are here to inspire one another for a greater height. So God bless you all and thank you.
Round of applause for the Dean. We want to recognize the presence of the Dean of Faculty of Physical Sciences, Professor Sᴄɪᴇɪ Emmanuel. Please stand for recognition. You're welcome. Please, one more thing left before we can call it a day. There's a cake, the Faculty of Basic Medical Science Conference cake before us. So I want to invite our guest lecturer, the provost, the chairman, and dean, including the chairman, the chairperson. They say you are not a man. According to Professor Mafia. So please bring down the cake. The provost, Afunwa, our guest lecturer, Professor S.C. Melodo, please want to cut this cake, and the dean. DJ, soft music.
Oh, Father, tell me, do we get what we deserve? Oh, we get what we deserve. And where down we go, where down.
Please, all the HOD, the Associate Dean, HOD, Department of Anatomy, Dr. Stanley and more, the HOD Physiology, the Professor I.J. Okafor, please, the Dean, former Dean, Faculty of Basic Medicine, the Dean of Physical Science, please.
I'm as calm as we are.
So now, ladies and gentlemen, it's time to cut the Bamsa conference cake. Okay? Is there a person that needs to be here?
Il la voit partout, il attend debout, une rose à la main, à part elle il n'attend rien. Rien d'autre.
Please, HOD Physiology, they say she's coming. Should we proceed? Okay, let's proceed. So now we are cutting the cake with the spelling of. Should we use Jesus or Bamsa? Also, I'm going to give Jesus cake. It's nothing. Let's cut with the spelling of Jesus. Give me J. Which one be hey? May we get closer. Make the thing fine for I. Give me J. Give me E. Give me S. Give me U. Give me S. Whose name is that? Thank you. No clap, no clap, no clap, no clap. So now, DJ, I beg, where the cake carriers? Where they can come on the cake? Let's move on to the next thing. If you want entertainment, make some noise. Body is what? Body is tea. Manati are the draw for. Now why did they cheat on you? My own body now apple. 4 rap. Oh no, DJ, get ready for Elite Heritage.
Please, the other guests, lecturers and other guests, please. Where you'll be entertained is the Faculty of Basic Medicine conference room.
I beg, as Elite Heritage, they come dance. All this wire, make una help them, they look up. Because their energy too strong. So now, ladies and gentlemen, if your hands are not too busy, let's give it up for Elite Heritage in the building right now. DJ, let's go there. DJ, do fast, I beg. After this thing, may we dance more.
But not me someone, eh? But not me open the table. Engineer Bruno. Abadia bakri boy yawa. Arabanko kuchoba. Arabanko. Ezo kwezo kukiche mati makola gakoko.
You see?
Ezo kwezo kukiche mati makola gakoko. Akoko mereme. Omere kogi state mama. Omere kogi state papa. Ebe mujale kulo bilongo na degu. Mane harusi, wano biya wamede monu o brother. Anye jema, nuna kogiro, nchiche se waleba. Tawusa loburu kanopinde manu awalaga. Wapo buru uyelunde manu no nimea. Ebe mo. Ojukwu bucket again. Ojukwu bucket again. Anyetima. Mbodo na lo ireneba. Abu amabiaku ganye shabru mundeji na biana. Awu weri yage mele mu mama. Sanwo kumo. Achogu kelugu o. Brother onukala. Arabanko. Ebanye jina rose. Arabanko. Ebanye jaroda. Arabanko. Ebanye jangumbo. Arabanko. Ebanye jina ngumbo. Arabanko, Tekena Pepe, Arabanko, Taxi drivers, Arabanko, Campo drivers, Arabanko, Okada Pepo, Arabanko, Ufodu Jaroda, Arabanko, Mongwe Beti Beti Mpere, Arabanko, Ufodu Jaroso, Arabanko, Teni Beti Maroda, Arabanko, Tekena Pepe, Arabanko, Island,
Hey, Chukwu, Osegwagi na boku, Chukwu Chukwu na bia keneli, Chukwu kike na boku, Chukwu. Ese ke mama mase Chukwu okike. Obo bia keneli.
Obo jide ni.
Yori mi o ni beneme na ni bo Chukwu. Sefu wa Chukwu bia keneli. Even in Africa, 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 wake up, Africa, wake up, Africa. Hallelujah, women. No one, I want you.
the palace name. cannot do. And you cannot say clap. Are we not clapping for Airline Heritage? Let's clap for them, let's clap for them. It's not easy, see performance. You cannot dance, you cannot clap. Getting me down and be Lord of God. Very money. Where am I? What are you saying?
Thank you. Please, we are running off. You hold on for your entertainment here. I want to use this opportunity to thank each and every one of you who have made our time to attend this conference. Thank you once more again. And I also want to remind you that the exam starts next week. Just like I said. So, on behalf of the provost, the dean, and the chairman of the local organizing committee, I want to appreciate you for making our time to come here to attend this conference. And I believe that you gain something significant. And I I want to also thank the chairman LOC for this wonderful organization. And also, I want to thank the Dean of the Faculty of Basic Medicine for disbursing the available funds for that. I want to call up my friend and one of our PG students to say the closing prayer. Please remain calm here. Your entertainment will come here. Be a good student. And remember, like I said before, your exam comes next week. Thank you very much.
May we stand up, please? May we stand up for prayers, please?
Please, let's stand up for prayer. After the prayer, we continue, I beg. Stand up for prayer.
Praise the Lord. Praise the Lord. Father, we thank you for the opportunity you've given to us today to be gathered here today for this conference. We thank you for the success of this conference. We thank you for everyone that came here successfully. We thank you for bringing this to an end. We thank you for all our students, all our visitors, and everyone. We give you glory for everything that has happened here today. Lord, we are asking that as we are departing, go with us. We ask that as we return to our various destinations, so Lord, guide us, protect us, and as our students are preparing for the exams next week, we ask that you give them retentive memory, that you help them in their studies, give them understanding and knowledge, and at the end of the day, let all the glory be given to you in Jesus' name. Amen.
I beg me una sit down chop. They go serve una food here. Some have food. You say, For the food we are about to eat, we thank you, O Lord. I beg, this food is strictly sponsored for those that are paid.